Today I'm joined by Dr. Glen House. Now, Dr. House, as you're going to hear, is a pretty remarkable guy. He is the medical director at the Capron Neuro and Trauma Rehab Center in Colorado Springs. He's board certified in physiatry, physical medicine, and rehabilitation, which is a specialty of medicine dealing with basically loss of function from brain injury, spinal cord injury, strokes, even Parkinson's. People have lost function and need to rehab to regain their neuromotor function. But as you're going to hear, he also is a patient himself. 30 years ago, he suffered a terrible accident, spinal cord injury, became a tetraplegic, which you'll hear him explain what that means for him. So it puts him in a very unique position to understand his patients better than any other doctor and help his patients. And one aspect that really wasn't getting the attention that he now knows it deserves is nutrition, and specifically nutrition to impact the metabolic health that deteriorates in spinal cord injury patients over time, and nutrition that could potentially acutely help reduce the amount of inflammation and the amount of damage done from spinal cord injuries. This sounds like a very specific intervention, but it really has some broad-reaching potential for all neurological conditions. So it's a really interesting topic to discuss. So I hope you enjoy his perspective on this and our discussion on this, because it really could, it's sort of at the forefront of the research now, but has the potential to really expand and be pretty dramatic and pretty impactful. Well, it's interesting. You really have sort of painted the picture of the perfect setup for insulin resistance and metabolic syndrome, but not something that everybody would think of looking at a patient who's thin. But if their muscles aren't using glucose because they're paralyzed and atrophied, and they're like the extreme of the TOFI, the thin on the outside, fat on the inside, because they have the adipose deposits. And then once you get the fat in the muscles, that is the absolute setup for insulin resistance. But my guess is that that's not a very common consideration for spinal cord injury patients. And you're probably on the forefront of people talking about this.
I think that there's some really good people out there doing studies. Particularly a gentleman who's well known named Bauman out in the literature, and he's described this quite a bit. I think in general, I think the spinal cord population, I think they're still all nervous about going at it with a high fat, low carb diet. It's still, the recommendations still are low fat. Of course, I think everyone would agree with eat your vegetables, get your carbs there, your complex, vegetables. I try to not eat more than one fruit a day, but I think the spinal cord population needs to be focused on this more than anybody. And people with limited ability to move. I mean, you just think about my entire body. Literally probably 3/4 of my muscles in my body are not even contracting. And so they're not there to utilize that, burn and utilize and store that glucose, that glycogen. So what I normally eat, and you guys, everyone that can walk around, utilizing that throughout their whole body, I don't have that ability. So it's easy to understand why it goes up. And it gets worse and worse and worse with time after spinal cord injury.
Yeah, so I can see how that definitely would be a challenge, especially if it continues to progress over time, but maybe not everybody's addressing it the way it should be addressed. But talking to a spinal cord injury patient about nutrition, I'd imagine is very challenging in the beginning because there's so much they need to change. And you could talk about depression and just how much life has changed. To talk about nutrition, I'd imagine is pretty challenging. So do you find you have to have that discussion like later on in their progress, or do you still try and have it right away to get them educated about it?
Yeah, I think for the younger population, I think it is kind of you're right. They've lost a lot, and you're going to take something else away. I really don't usually address it so much at that point, unless I find out they're insulin resistant already or diabetic. I actually address it a lot with my older population, the people that are coming in with strokes and the people that are coming in with other, and I'm identify them as new diabetics, or you can tell they're insulin resistant on their way anyways. One of the things I will say when we talk about like where's it going with spinal cord injury, I think some amazing research has been being done at it's actually called iCord So icord.org. It's up in British Columbia, and I spoke with actually the director up there. His name is get his name right. It's Wolfram Tetzlaff. He's an MD, PhD. He's the director of that, and he's done some amazing studies on ketogenic diet in spinal cord injury and alternating basically every other day fasting. So what he showed, and he initially did it in mice, is that when he gave the spinal cord injury and they gave him a ketogenic diet, a high fat compared it to a standard diet, they had a significant improvement of their cervical spinal cord injury, their motor return of their upper extremity on the ketogenic diet. And that is basically, they're describing that. It's in plenty of places in the literature where it's describing that ketogenic diet or ketosis as neuroprotective. So it's actually decreasing having some inflammatory effects on the spinal cord. That was followed up with, and he helped, I believe, in collaboration at University of Alabama in Birmingham, where they did actually on patients with spinal cord injuries. So they did a pilot study, and they took individuals and they did some every other day fasting, and they also did a high fat, low carb ketogenic diet with 75 to about 80% fat. They also identified that they had, and they looked at biomarkers also, but they had an improvement in neurological recovery. So at least, and that's being expanded. Those studies are being expanded, but that is where this should be going. I mean, really in the spinal cord injury population, we should be stop everything. Let's just figure this out. Let's study this like crazy. Let's get some objective data. We've got, especially with these patients, you have them kind of in a group and in isolation. It'd be very easy to show, and I think that's progressing. So I think that is changing, as we speak.
Yeah, I think that's the most fascinating area of ketogenic diets. I think in neurologic function and in spinal cord injury or strokes. I mean, there's the longer term metabolic dysfunction that we've been talking about, but now you bring up this part, and this is what's so fascinating, like the anti-inflammatory component of ketones, or knowing that the brain can utilize ketones differently than glucose. Is the same true for spinal cords? Or, hard to know exactly what the mechanism is, but just the fact that a ketogenic diet, like you said, can decrease the amount of injury that occurs to the spinal cord, and that's been shown in the brain. So I think you're right. I mean, this deserves a ton of attention because, let's face it, there's not a whole lot else that has been used or shown promise, really, is there?
Yeah, so that's an interesting thing. Is we focused back in the 80s. There were some studies where they used methylprednisolone, high dose steroids. And I remember I was 1990. I had my spinal cord injury. I'm laying in bed, and on the news that study comes out saying, "Oh, high dose steroids in spinal cord injury. Basically, you're not going to have a spinal. You're going to be cured." And that's how I came across, of course, on the news.
Okay.
Well, as I got further into my medical school and residency, and then my internship, that actually came back around. And it was published in the Journal of Trauma, where it said methylprednisolone, an inappropriate standard of care. That was the standard of care when someone came in with spinal cord injury. It is no longer the case. In fact, they showed that he had more complications, more myopathies, problems with the muscles, and different types of infections because of the high dose of steroids and glucose. And so instead, we were trying everything we could at that point. We should be trying everything we can, whether it's ketogenesis, from a high fat diet, low carb diet, whether it's ketone salts, whether it's
Right.
whether it's every other day fasting. All those things should be looking at how do we get that ketone level to be neuroprotective. But I think it's difficult because you're talking about these people that were so ingrained to think we got to pump them full of calories and this on top of that, and you can keep those glucose and get all that up. Now we're saying, no, we're going to basically starve them for a day. And, I mean, the whole paradigm shift of thinking about this is a very difficult thing. I mean, can you imagine I bet they had a hard time passing that by the IRB, the Internal Review Board, at where they did it. So hats off to them.
Yeah, it is remarkable how it's a complete 180-degree turn. But I mean, you could see why there could be a difference, right? High dose steroids, powerful anti-inflammatory, but high glucose, and feeding them whatever you want. Compare that to a potential anti-inflammatory with low glucose and a different type of fuel with ketones, and a different anti-inflammatory with ketones. So you can see how that could be totally different. and really exciting. And that, I guess, that goes along with some of the evidence we have that that ketones may benefit cognitive impairment and Alzheimer's and Parkinson's and
Yeah.
traumatic brain injury. And we don't have, randomized controlled trials and throngs of evidence, but we have non-controlled studies, we have small pilot studies. There is evidence to show that ketones, either nutritional ketosis or even exogenous ketones, has some neuroprotective benefit. So why not study it more? And are you starting to see more people interested? I mean, you've mentioned two, one in British Columbia and one in Alabama. Are there more universities doing trials on this that you're aware of?
Yeah, I'm not aware of everything that's going on right now. I know they're
Yeah.
expanding the study they were doing there. I don't know how far they are along that. I mean, I did look at that, and they were still, where I looked it up recently, they were enrolling. So I'm very very excited about what the future is. I think this is clearly there's clearly enough data to say there's a benefit of it. I think
Yeah.
there's two ways to look at this. Also, it's acutely, so it's acute spinal cord injury, acute brain injury, all those acute injuries to protect and be neuroprotective and have less damage and stop that cascade that happens of the inflammation and all those cytotoxins that are coming in damaging. So you have the damage itself, you have the blunt damage or the lack of blood supply, whatever that damage is, and then what really damages things is all the inflammatory markers, that inflammatory
Right.
cytokines and all these things that come in because when they see damage, and when they see damage, they're bringing in stuff that is damaging further. So that's
Right.
kind of where that ketosis and that neuroprotective anti-inflammatory effect to stop that cascade happens. Then I think the second part of that is longevity. So my whole focus right now, I think I'm 51, when I did 50, I think really things changed to where it's like, oh, I got to start really, really focusing. And I had before, but I'm really focused on longevity and spinal cord injury. And what do we need to do? What are those things that, there's a lot of factors that go into that, but it is pretty well known that after about 20 to right about that 20-year mark, something seems to change in spinal cord injury to where there more and more problems happen.
Hmm.
And we also know, and I'm not saying this is exactly related, but there probably is a lot to be related, is that after a duration of spinal cord injury, this insulin resistant component gets worse
Yeah.
and worse and worse and worse. And then and so I was just shocked when this was happening to myself. We have no family history, no one with insulin resistance and or any kind of any diabetes. And here I am, I think I'm probably eating and acting as healthy as you can, and I'm starting to see that if I wouldn't have intervened. And and also I did, trying to be proactive about longevity. I also did in my calcium arteries, score, um, and it was zero.
Good.
And so I think so. Whatever I've been doing for the last 6, 7 years, this high fat diet leaves my at least has left my cardiovascular score, as good as it can get. But that would make sense because now my HDL is low, my HDL is high, my triglycerides are low, so I'm eating that healthy diet where my markers look great.
Yeah. So knowing what you know now, is there any question in your mind? If you knew then what you know now, would you have started a keto diet day one after your spinal cord injury?
Oh yeah, absolutely. And here's the other thing: it tastes great. I really, really. If wherever the science leads me, I'll follow. Right? If they come out tomorrow and it is slam dunk, there is no question that this certain kind of bread is the healthiest thing in the world. Oh, I'll just order it by the truckloads. But that's not the case. And here's the great thing about the ketogenic diet, or just high fat, higher fat, low carb, is that it tastes phenomenal. So putting away those salad dressings that say no fat with a lot of high sugar, and then
Right.
bringing in this high fat taste. I might just had it today. I had a big old salad. Just dumping the salad dressing on there, or the olive oil, and it's just it tastes fantastic. And the
Yeah.
recipes on Diet Doctor are just unbelievable. You look at that I look at that website, and I'm just start. I just get mouth start watering when I start looking at some of that stuff.
Great.
It's really good to be able to, and let me say that too, is I used to, basically have somebody that I wanted to talk about. What are they going to do? How are we going to intervene? I would say, well,
Yeah.
read this book and that book. That's not going to happen, right? But now I can say, look, you go to this website And then I want you to come back and I want to report to me and we want to talk about it. And I want you to, I want to look at your numbers. And then I want you, and that's how I guide them through that. And I say, I want you to intervene. I want you to start looking at that. And I want you to, and I start out, I don't go right to 20 carbs. I mean, I do kind of gradually get them down. That's just
Yeah.
how I do it. But I want to shoot, try to get them around if they're not, a type 1 diabetic myself. I don't, I'm not, I know people are, but I'm not, I'm not comfortable with that. But if someone's
Sure.
insulin resistant or type 2 diabetes, I clearly start doing that. And I even do it in the hospital. When people come in, I'll start changing their diet. Like the diet they get in the hospital, I mean, and this is throughout the United States, but the diet they get in the hospital, you almost have to get out of the hospital to really be kind of healthy. I mean, their sugars start going up because they are allowed 60 carbs. It doesn't matter what they're eating. They can have toast as long as they're staying on that 60 carbs per meal, per
Yeah.
meal. So then they get a snack at night for another 10. And that's the type 2 diabetic. And I start saying, no, you know what? We're going to go to 30 carbs a meal. And that, so we're now at 100. And it is unbelievable how their insulin starts going down because they're on, like, say they're metformin and they're on insulin sliding scale, or they're maybe on some Lantus. A lot of times we're able to completely get rid of the Lantus, and then they're usually not even needing the sliding scale, and the metformin is doing it alone. They're diet controlled. They feel better. That's rewarding. That's a fast turnaround.